Hello everyone, my name is Dr. Vallabh Chawla and today we'll be doing a case report on micro crack line as seen in the CBCT scan. Okay, so patient had basically come with a chief complaint of pain in the upper left side. Okay, so the clinical doctor could not find any findings since the restoration was present. So we took a CBCT scan of the upper right sectional and we could find one secondary caries as seen over here. This is a secondary caries just beneath the restoration. This is finding number one, and even some kind of incipient caries, dentinal caries in 2-6 region. So this is 2-6 dentinal caries, and there is secondary caries just beneath the restoration. Okay, so these were two findings, and also when we took it from seed in the axial cross section, as we just go from crown occlusal aspect down, there is a secondary caries over here. I'll just mark this thing. There is a secondary caries, and then we take it down. As we go down towards the dentinal region, we approach the coronal pulp horn. There is the coronal pulp horn which is seen. Okay, we can now slowly appreciate some kind of micro crack lines that are visible over here. On the palatal aspect, some kind of micro cracks is visible. You can appreciate well by adjusting the contrast. Okay, so this is like a micro dentinal micro crack line which is evident well. It is restricted to the crown region itself, so extraction is not recommended. We can do it by treating some kind of root canal treatment. And as we go down, you can see the radiolucent line is not visible. Okay, so there is evidence of MB canal. So this is MB1, MB2, palatal, and distobuccal canal. Okay, so 4 root canals are available in the 3 roots. Okay, we'll just take this thing back again to the crack line level. So there is a crack line that is appreciated well. We'll just study the crack line. If they are visible in any other cross section, we'll just arrange it along the long axis of the tooth. Okay, so somewhere this specific region, there are chances of dentinal crack line being evident. Uh, the crack line may not be visible clinically, but it may be present in the dentinal layer. It could be because of the heavy masticatory forces, could be one of the reason. Also, similarly, the heavy crack line, we'll have to evaluate this specific region once over here. So this is the region of interest, the palatal aspect. Okay, you can study this in smallest cross sections as well. So this is a region of interest where the crack line may be visible. There is the secondary caries that are seen, and somewhere on the palatal aspect there are chances of crack line being present. Okay, so this was all about micro crack line as seen in the CBCT scan. Also note that they may not be visible clinically or in any can be visible only in 1 or 2 cross sections since it is a micro crack line. Periapical pathology may not be evident in such cases since it's being a micro crack, but definitely some kind of PDL reaction may be evident. So just like in this case here, you can see PDL widening is present in the distobuccal root and a bit on the mesiobuccal root as well. Okay, so this was all about micro crack lines. PDL widening is also available seen in the palatal root. So this is the palatal root. We'll just arrange the palatal root along the long axis of the tooth. So you can just check this thing, palatal root along the long axis. The palatal cusp needs clinical evaluation over here. Okay, and there's the PDL widening as seen in the palatal root. Okay, so this is PDL widening. This could be either because of the secondary caries or presence of the micro cracks. Okay, so this was all about micro crack as seen in the CBCT section. Thank you so much.